The first doses of the newly approved Pfizer coronavirus vaccine have arrived in the UK. They've been taken to a secret location from where they'll be distributed to hospitals all over the UK over the next few days. The first phase of the rollout programme is expected to begin on Tuesday. England's Deputy Chief Medical Officer, Professor Jonathan Van Tam, says 99% of COVID-19 deaths could be prevented if there's a very high uptake of jabs in the most vulnerable groups. It comes on the day that the UK recorded the deaths of more than 60,000 people with coronavirus, one of the highest death tolls in the world. Here's our health editor, Hugh Pym.
He was the soulmate to my grandmother and he was my best friend. He put a smile on anyone's faces he met, and he brought the sunshine on the rainy days.
Olivia remembers happier times with her granddad, Gary. He died in hospital with COVID. He did have underlying health issues, but he was just 61. His funeral was on Tuesday.
Before he passed away, we were able to say goodbye on FaceTime. And as much as it's lovely, we were able to say goodbye that way. I just wish we were able to hold his hand and let him know it was okay.
Mickey died last month after being diagnosed with COVID. His family say he'll be much missed in the community.
He wasn't in bad health leading up to contracting COVID.
His daughter-in-law Anna said he was a local Bristol legend.
The speed of it, the shock of it has left us all absolutely devastated. We're reeling from it. We can't believe it's happened. He was larger than life, and I always say I thought he would outlive all of us.
All this a reminder of the cruel reality of COVID and why vaccine doses like these are so important. Some have been brought into the UK on Eurotunnel from the manufacturer Pfizer's plant in Belgium. Phase 1 of the rollout will start next week, and health leaders are encouraged.
If we can get through the phase 1, and it's a highly effective vaccine, and there is very, very high uptake, then we could, in theory, take out 99% of hospitalisations and deaths.
Some major hospitals like this one have been designated as vaccine centres. It's understood that the policy in England will require them to prioritise patients who are 80 or over, for example, those coming in for appointments. NHS staff and care home workers will be invited in for their jabs. The First Minister said Scotland's vaccinations would start on Tuesday.
That will be a significant landmark in our collective struggle against the virus. And although we still have difficult months ahead, the awareness that vaccination is starting will, I'm sure, make many of us feel more hopeful as we enter the Christmas period.
For the families of Mickey and Gary, there are mixed feelings after news that the vaccine is about to become a reality.
He was only 61. Maybe he could have had longer. And I can't look at the vaccine knowing we couldn't save him. It's too late for him.
I can only implore everybody that is offered the vaccine to take it, because you do not want to find yourself or a precious, loved family member like Mickey in a similar situation.
The vaccine is on its way. Military and NHS staff have been setting up specialist hubs like this one at Ashton Gate Stadium in Bristol, but the wider population may have to wait a little while to get their chance to have it. Hugh Pym, BBC News.
So the first doses of vaccine are here, but it may well be many months yet before any resemblance of normal life returns. Scientists say we will be living with these restrictions on our lives for some time to come. Our science editor, David Shukman, looks at the new vaccines and the way ahead.
A gloomy afternoon, though at least there's now a pathway out of the pandemic, with the prospect of the first vaccine to keep people safe. So what questions remain unanswered? Well, the first is, how long will immunity last after you've been vaccinated? Well, that's still not clear. Studies show that the injections, 3 weeks apart, massively reduce the severity of the disease, but scientists don't know if that protection keeps going.
We have no clear idea at the moment about how long natural immunity, so immunity following the infection with the virus, or indeed immunity that's been generated through vaccination, how long it will last. We would certainly hope it will last several months, if not years.
So it's possible we'll need an annual vaccination. As with the winter flu, all this has to be worked out. Next, will the vaccine stop the spread of the virus? If you've had the vaccine, you could still carry the virus without knowing, and maybe pass it to people around you if they've yet to have their jabs. That's because the vaccine will be injected into the arm to create antibodies to fight the effects of the disease. But the virus itself may still be present in the nose and throat. So it's possible that someone vaccinated may be able to infect others. No one can yet be sure.
It could be that vaccination could allow the virus to carry on replicating in the nose, but not actually causing symptoms. And that could mean that actually you can still be a vector despite having been vaccinated and despite being personally protected.
Then there's the question of how many people need to have the vaccine. The more infectious the virus, the more it matters to get a high proportion of the population vaccinated, at least 90% for measles, more like 66% for COVID.
The more people who can receive the vaccine and get it, the less the virus has a chance to spread in the community, and therefore we minimise the risk to those vulnerable people in whom the vaccine doesn't really work as well as it might. So getting the vaccine once it's available is something you can really do to help protect other people as well as protecting yourself.
So everything hinges on making sure as many people as possible say yes to the vaccine, and until they've had it, to keep following the guidance about staying safe. David Shukman, BBC News.
So the UK is the first in the world to approve the Pfizer vaccine. Confidence in its safety is critical, yet the speed of it all has been criticised by some, including the top infectious disease expert in the US, Anthony Fauci. Our health editor, Hugh Pimp, is with me, and tonight he has rather changed his tune.
Yes, Sophie. There's been a bit of sniping, both from European health officials and politicians and those in the US, about the MHRA's decision to approve the Pfizer vaccine yesterday ahead of other leading regulators. And Dr. Anthony Fauci, member of the White House Coronavirus Task Force, said in media interviews, quotes, "The UK didn't do it carefully. It rushed through the approval." But in a BBC interview tonight, he's rather rowed back. Here's what he had to say by way of explanation.
Our process is one that takes more time than was taken with the UK. And that just is the reality. I did not mean to apply any sloppiness, even though it came out that way. So if it did, I just want to set the record straight. I have a great deal of confidence in what the UK does, both scientifically and from a regulatory standpoint. If I somehow came across differently, I apologize for that.
Well, there was a hint there, and he went on to explain that in the US, they felt that it was necessary not to be seen to be rushing things through because of sensitivities around the vaccine debate and the politics of it. And it just shows how keen regulators are to show that they've gone to every possible length to make sure these vaccines are safe and not allow the anti-vax campaigners to exploit the situation.
Hugh Pim, thank you.